Hi, my name is Michael Dell. I'm a Ganawagi Rono living with special needs. When I was interviewed, I had an idea for a show for people from Ganawagi living with disabilities. Today is the start of that show, Walk in My World. Often, people with disabilities lead sheltered lives, and their interactions are limited to caregivers and family members. I hope this show will bring you awareness of these people, their families, their lives, and their dreams for the future. Okay, today we are here at Cadre Hospital to interview Dale Beauchamp. The topic is about Alzheimer's disease. And Dale, before we start, maybe you can explain your position here at Cadre Hospital.
Okay, so I've been at Cattery for 8 years as of October. I work in the social service office with Cindy Boyer, our social worker at Cattery Hospital. My position here is more of like caseworker. I am also a liaison for home and community care and the resources here in Ganawage. So I help with discharge planning when our patients come in for short-term care, and I work with our day center clientele as well.
Being a social worker, you must come across all time Alzheimer's disease.
Yes, we do. In fact, there is a lot of information that we do obtain from the Alzheimer's Society to pass to our clientele here at the hospital. We get a lot of pamphlets, booklets, things like that. There's also two other people that are in my milieu, which is Cindy Boyer and Jean O'Connor. Cindy Boyer came on to Cattery about 4 years ago, and she wanted to head up some information regarding support groups and things like that with the Alzheimer's. So she decided to contact the Alzheimer's Society and see how we can obtain services here in Ganawage. So it started from there.
What's the difference between regular aging and Alzheimer's disease?
For me personally, regular aging is just our body's getting older. It's a regular process that everybody goes through. And the Alzheimer's disease is it's a disease that attacks our brain. So it's a kind of degenerative disease, and it causes plaques on the brain. So it kind of attacks our brain and covers it with plaque, and it clouds it. Whereas a dementia is more of like a syndrome, and it causes memory lapses and behavior changes, as does Alzheimer, but the Alzheimer's is like, I guess, more of a physical type of occurrence that happens with the brain.
What are the symptoms of Alzheimer's disease?
So some of the symptoms that one might notice is, as I've said to you a little bit earlier, people often think that forgetting keys in the doorway, or forgetting their purse at home or on a chair, or misplacing their clothing is not some, it doesn't mean that you're suffering from Alzheimer's disease. What you have to kind of worry about is if you find your keys in the oven or your purse in a freezer, the refrigerator. Those are the types of things that you would have to start thinking, oh, there's something wrong here. What's going on with me?
Are people aware that they have Alzheimer's disease?
A lot of clientele that I've come across or had to work with often say that they've not known that they had Alzheimer's, but they suspected that something was happening with their memory. And people often start to worry, like I said, when they start forgetting names or places. Again, what you have to worry about is if the names don't come back to your memory, or you're traveling on the road driving and you completely forget where you're going. Those are the types of things that you would have to start questioning yourself about.
So, when, for example, when they go to the bank too many times in the same week, uh, maybe that could be a sign of Alzheimer's disease for some people.
It's definitely a sign that there's something possibly going on with them.
Yeah.
So what I would suggest is that they would go to their doctor and speak with them about what they've been experiencing. That would be the first thing that you would have to do.
Okay.
It's a good idea to, if you're starting to suspect something's going on with you, go to see your doctor, make an appointment, and see if you can get a diagnosis. And if the diagnosis is that you have Alzheimer's disease, then there's things that you can do to prepare yourself. Getting a diagnosis is, you can call up any Alzheimer's Society. There's information on the website. We have pamphlets here at Cattery Hospital. You can call there yourself. It's a toll-free number, and ask them different questions. They're really the experts in regards to Alzheimer's disease. And they would probably do the same thing as direct you to your doctor and go for testing.
So when you go to your doctor, he or she can, there's a specific protocol that they follow to determine if you have Alzheimer's disease?
I don't know if it's a specific protocol, but some people that have come here to Cattery Hospital or outside do go to memory clinics. There's some memory clinics in Montreal that they can go to, and they have specific tests that they can do. There isn't anything that we can. There isn't a specific test or way of diagnosing Alzheimer's disease that's known right now. So there's like a lot of mini mental tests. There's a MOCA test. And like I said, you can go to the memory clinic, or your doctor would send you there himself. If he does a test with you in the office and he thinks your scoring is a little below normal, then he would probably refer you out to a memory clinic like at the Jewish and get a proper
Okay, so
diagnosis.
it's not as simple as coming here and maybe seeing occupational therapists, and maybe they can do some tests.
Yeah, the occupational therapist as well can perform these type of mini mental tests and do some scoring that way, and kind of well, not kind of, but give the information back to your doctor and recommend to you, that these are the normal scores, these are the scores that you have, and maybe we need to look into in sending you somewhere specific to get a memory to the memory clinic. So there's no blood test or anything that can be done in terms like that for medically speaking to determine if you have Alzheimer's disease.
In general, what are the impact on families that you've seen in Ganawage?
So once a diagnosis has been given, there's things that can be set up for families and for the patient to prepare themselves. And as I said, you can contact the Alzheimer's Society. They can help you tremendously in that respect. But some of the things that what you can do is speak with your doctor. They have the information as well. Speak with the social worker. They can help you with resources in the community, maybe preparing a home. If once the disease is advanced, then there's other things that you might have to do for your home. Remove some rugs and maybe install certain equipment at the door, so that if people start wandering when they get older, there's something that's attached to the door, so the caregivers can hear if the loved one is getting up at night. And there's a checklist also that I have here at the hospital that people can come and get from me and go through the checklist and kind of not diagnose their own loved one or their own caregiving, but keep in check as to certain things that might be causing more stress on the loved one or causing them more stress. And that's when we'd have to look into getting you more resources at home to help you at home with the loved one.